Hello, this next video is for all the parents out there who have any questions or concerns about their children's teeth. Hopefully I can cover some of those topics for you now. The first dental visit should be first year or first tooth. Generally at that time it's not going to be a cleaning, it's going to be an exam. You can get a cavity as soon as the tooth emerges from beneath the gum lines. Okay. Next thing is fluoride. Where you live, if it's not a populated city and you do in fact have well water, check with your physician, check with your dentist to see if you need to have fluoride supplements. Having the well tested is very important if you have that at where you live. Next thing is candy. Candy happens. The worst candy is a gooey, chewy, sticky candy that gets trapped in a molar. You see a lot of higher occurrence of cavities with children under the age of 5 because of the fruit snacks, the gummy bears, the Skittles, Starbursts that the parents are putting in with their lunches. It does happen. Have them brush right after, but not every day. At their own disposal. Next thing is baby bottle tooth decay. Contrary to what it sounds like, you can get this type of anterior, called front decay, not only from a baby bottle, but from nursing, from sippy cups, and with a regular cup even. Mainly because when it first enters the mouth, the first teeth that it hits is the front teeth. You see a lot of decay because parents are not aware of this, and breast milk is actually sweeter than cow's milk. Little fact to throw in there, but milk does contain sugar that causes cavities just the same. When you give them juice in a sippy cup, let it be during meal times. Don't go ahead and let them have it in full. Don't dilute it or have them drinking it all throughout the day. It's not the amount of sugar, it's the frequency. So breakfast, lunch, and dinner, let them enjoy the milk and juice. In between, please do water. Before bedtime, plenty of water, not juice or milk. A lot of parents come in, they're complaining because their kids grind their teeth to no end while they're sleeping. The theory is when kids grind their teeth, it's not because they're stressed out. One theory is that it's genetic. Another theory is that it's a mechanism of loosening up baby teeth. So we don't become concerned or have any treatment that's recommended unless they're grinding their permanent teeth. So we get that a lot. Another thing, those of you who have braces or I see you chewing gum or sticky gooey candy, yeah, I'm sure your orthodontist told you that it was a big no-no. What I found is that it is possible to to chew gum with braces and not get it stuck in their brackets, but what I've learned is that because gum is not intended to be broken down and swallowed or and to be ingested, is that it's supposed to create tension, and that tension within your braces rods, it loosens it up, it bends them, and that means it's not tightening your teeth. So that means you're going to have the braces on a lot longer because it's actually reversing the process that you're to get the desired effect, or the whole purpose of having the braces. So, what else I wanted to say? Oh, those of you parents whose children currently have their first brand new teeth in the front, and you think that they're yellow and you're sending them back to the bathroom, yeah, no. What the thing is baby teeth are actually considered milk teeth because they're so white and so bright, and that's because they're very thin. Permanent teeth are thicker, stronger, and they have a yellowish hue to them. So in contrast of brand new permanent teeth and then the baby teeth everywhere else, the baby teeth will win as far as who's the whitest. So if it's an overall color, that's just the color of their teeth. If it's blotchy coloring, yes, send them back to the bathroom. They're not brushing. Thumb sucking and pacifiers. The thing with this is a tricky topic because with thumb sucking, you can't remove the thumb in order to break the habit. It's more of a mental thing. But we like to encourage parents to help them stop by age 3, 4-ish. Because after the age of 4, the pout, the roof of the mouth, begins to form and solidify. And then, you know, if it's deformed or if it's been altered, that formation, because of a thumb pushing it out or a pacifier, you know, pushing or widening it, that's permanent from that point on. So something to consider. Sometimes when babies are small and they have a soft spot in their skull, but after a certain age it hardens. The palate is very similar to that. And having any objects or any fingers in their mouth will change the shape. What else did I want to say? Oh, mamelons. What those are in the brand new permanent teeth are little bumps, little ridges on the bottom. And the parents are like, what is going on with the shape of my child's tooth? They're called mamelons, and teeth as they're formed in lobes, like little circular lobes, and they form together to form one tooth. And with brand new teeth, you see them a lot more prominently on the chewing surface in the front. But as they, you know, grow older, it'll begin to wear down. Unless you are in my family, and all of us still have our mamelons, I've just grown accustomed to mine. I could flatten them out, but I enjoy them. And see if you see mine. Little ridges. Okay. I don't mind mine. This is what it is. Okay. A lot of complaints that parents will say is their children having bad breath. If you're brushing and you're flossing for them and you still find that their just breath is knocking you out on the floor, check to see if they have any sinus infections, if they have any post-nasal drip. A lot of that can contribute to any sinuses, things like that can contribute to bad breath. So it might be something bigger than just brushing and flossing. Okay? And last but not least, another fact that I want you parents to make sure that you understand is if your child has a cavity in their baby tooth, the relief is, yeah, a permanent tooth is going to replace that tooth, but you do want it to get fixed because baby teeth do not fall out until about between, it depends on the child, but the range is between 11 years old to 13. So if they're 4 years old and they have a cavity in their molar, that's a lot of years for that cavity to be in their mouth, and that's going to infect the rest of the teeth beside it, spread throughout the mouth. So please go ahead and get a filling put in. You can decide amalgam or composite. A lot of parents will pick amalgam if they're not crazy about the mercury in amalgam. They'll go with the composites. The composites are more, they don't hold up as well, but again, it's a baby tooth, so it all depends on you. Well, I hope that helped. Parents, if you have any question, or teens, if you have any, whoever's watching this, anybody who's watching this, if you have a question, send me a comment, and I'll get back to you. Thanks, bye.